We all have emotional skin in the game in this, right? And this is a very, very big deal. And this is a very, very touching moment for a lot of us.
I'm blown away. The entire process, starting with brainstorming about what we believe is necessary, working with an architectural firm that understood how to create that, and what it looks like now and what it feels like to be standing in it, and what it will be like to be working in this space and receiving care in this space.
It leaves me speechless, because to think about the people, the community that really need this, for those who feel like they're just stuck in the system and they get stuck in the emergency department or stuck at home or stuck with crisis, that we're able to open more beds and more availability to be able to help them.
We've seen from a community perspective the increasing need for mental health services. We've seen it for the past decade, rapidly accelerated during the COVID years. And while many organizations kind of retreated a bit because of the financial situation in the market, Northern Light Health took a strong and bold step forward. And they said, no, you know what, these services can't wait.
Make sure you have a tour. Make sure you have a tour, because when you hear the thought that's behind, the little details maybe to us are a big deal to our staff and to the patients and families for confidentiality and safety and just respect. It's beautiful.
The impact is vast of this building. You know, when we developed this building, we were looking at the most up-to-date evidence of how do we keep our patients safe. Patients who have learned maladaptive ways of managing things, who struggle on a minute-to-minute basis.
Every part of this process was critically analyzed, not only to create a safe environment, but to create an exceptional care environment as a whole. And from an experiential perspective, I mean, we're standing in a hallway right now that's got to be 20, 30 feet wide. Something you don't typically see in a hospital environment, especially an inpatient psychiatric environment. So when we think about that experience of care, if you're someone here receiving services, I mean, just look how you feel. It feels warm, it feels welcoming.
To be able to offer more space to do group therapies, and then on top of that, having our own dedicated occupational therapy room for kids who are so sensory, and it helps them so much. It's just beyond words how much and how thrilled I am to be able to give that to these kids and their families.
When children and adolescents are struggling to the point of needing to be in the hospital because of a lack of safety or control, that is challenging work. And an environment that supports that and is an inspirational space for all, just deep gratitude for everything that everyone has done, and great excitement for the miracles and the lives that we're going to change in here, in this space.